Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Fasudil. What is Fasudil? Fasudil is a selective Rho A or selective Rho kinase inhibitor. Fasudil is a selective Rho A or Rho kinase inhibitor. What does this Rho kinase do? This Rho kinase plays an important role in vasoconstriction, and it is also important in vascular remodeling also. Okay, this Rho kinase causes vasoconstriction. How? Because this Rho kinase will actually it will increase or phosphorylate. This will cause or increase the phosphorylation of myosin light chain kinase. It increases the phosphorylation of myosin light chain kinase, thus causing the vasoconstriction. So the uses of Fasudil. Fasudil is mainly used in the treatment of, you can use it in the treatment of cerebral vasospasm, and sometimes it is also used in the treatment of cerebral vasospasm which can be due to the subarachnoid hemorrhage. Okay, it can also be used to improve the cognitive decline. It is also used in cognitive decline, especially in patients with stroke victims. This is also used in pulmonary hypertension, or it can be used as a prognosis. Actually, it is used to improve the prognosis in patients suffering from Alzheimer's disease. Then it is also used in Prinzmetal angina, or we can also use it in vasospastic angina. So these are the important uses of Fasudil.
thank you and thank you for watching.